Hi, my name is Dr. Michele Finneran with Beck & Associates, and in this short video, I'm going to provide with you just some statistics about first responders and their mental health, and what 4 things city municipalities and agencies can do to be more progressive with their first responders. Some statistics provided on frontline first responders and their mental health have been documented by the U.S. Department of Health in a supplemental from the Substance Abuse and Mental Health Administration Help for Heroes program. The statistics reveal the following associated with firefighters, police officers, and EMS professionals. It is estimated that 30% of first responders develop behavioral health conditions, including, but not limited to, depression and PTS, as compared with 20% of the general population. In a study about suicidality, firefighters were reported to have a higher attempt at ideation rates than the general population. In law enforcement, the estimations suggest that between 125 and 300 police officers commit suicide every year. These are some staggering results compared to other professionals. So what are some 4 progressive interventions that can help municipalities and agencies with first responders and their mental health? There's IOP programs, or intensive outpatient programs, peer-to-peer support, state-based programs, and marketing the right approach. Let's first start with IOPs, or intensive outpatient programs. As a part of a progressive step to help first responders navigate the negative effects of the role, and more clinics are using IOPs, or intensive outpatient programs, as an avenue for hope. IOPs provide a more aggressive intervention path for first responders to be treated, which is being proposed and implemented as a possible solution to regulating trauma symptomology. IOPs are designed to deliver mental health and substance abuse treatment in a more rapid fashion, establishing rigorous psychosocial support for participants and addressing relapse anchors while enhancing the individual's coping skills. The IOP outpatient setting also provides mental health clinicians and social workers the opportunity to work intensely with the patients daily for an extended amount of time. Let's get into peer-to-peer support. Utilizing peer-to-peer support sessions as a way to become more dialectic in communicating and processing various trauma is also finding its way with resourcing for first responders. Peer support programs are being implemented in the United States, Canada, and other countries across the world. They are steadily becoming part of the frontline first responder programs, such as police officers' peer support programs. One of the main goals of such programs is to help, for instance, police officers handle the exposure of daily stressors and traumatic material by being more able to process it with a peer. State-based programs. The rise of more state-based programs, similar to the program sponsored by the University of Texas Health Science Center at Houston, have worked toward designing and implementing short continuing educations, or CEs, virtual training programs specifically for first responders. It's to help describing how to recognize mental health and substance abuse issues in oneself or in one's peers. They've also established a statewide completely confidential toll-free helpline, 1-833-EMS-IN, Texas, TX, to provide screening, brief intervention, motivational interviewing, and other resources for first responders. Other states like Texas has formed similar programs. And the hope is that more state agencies begin addressing the mental health needs of first responders as programs like this begin seeing results. Lastly, marketing the right approach. Another idea comes from the prospect of how such resources are marketed to both first responders and their agencies. Those working as mental health professionals like myself need to find more creative ways to market the potential in counseling therapy to first responders who might be hesitant to engage otherwise. As a mental health provider working with first responders, the biggest thing that I've learned is to attain trust and consistency while treating first responders. Being more exposed by doing ride-alongs, doing presentations, hosting luncheons for the department, and being visible to the first responders, which would make the first responder more likely and comfortable to open up in sessions. If your city needs consulting on how to be more progressive with your first responders, please reach out to me on my website, www.buckandassociates.com. Thank you.